Hello, everyone. I'm Nancy, and this is a research study for improving healthcare personnel compliance with safety practices in infectious disease clinics. It is challenging for healthcare personnel to comply with safety practices, like how to properly use personal protective equipment and equipment that is used in the care of more than one patient. An article published in Oxford University Press found that nurses and physicians are having difficulties with complying with the properly use of gowns. Also, there is not a protocol for the sanitation of glucose meters, and doctors favor the use of their own stethoscope, disregarding the protocol of using the stethoscope inside the room. Being an infectious disease clinic, we have put an emphasis on safety protocols for the exposure to bloodborne pathogens. Now we have to understand that not properly using PPE and not complying with safety protocols for the use of equipment increases the risk of the healthcare workers to be infected and the risk of cross-contamination. For the first part of the research, we will use the case control retrospective method to determine common challenges among healthcare workers. We will conduct a survey in our clinic and in other similar clinics. Here is an example of the survey. We are choosing case control study to do this part because it allows us to look at multiple factors. We will use safety protocols filed for the last 3 years at our clinic and the other clinics we have selected to determine if there is an association to the challenges healthcare workers have identified in the survey. To achieve our objectives, all healthcare workers who are part of the healthcare workflow needs to participate. Front desk workers, MAs, nurses, and physicians. After finding the common compliance challenges, we will implement a strategy for motivate the proper use of PPE and the compliance of safety practices when using equipment. For the second part of the research, we will conduct a randomized controlled trial. We will monitor for a year if healthcare workers' compliance has changed after implementing the new strategy for improving compliance with safety protocols and using PPE properly. This is a graphic of our randomized controlled trial. We believe that this study will help us to discover the challenges healthcare workers are facing for complying with the proper use of PPE and safety protocols when using equipment. The success of this research will allow us to conduct future research in other areas of our workflow to improve safety protocols.